Imagine having STI and you don't know you have STI. That is how tricky STI can be. Many people out there have STI, but they may not show any symptoms. And the fact is, they can transfer it to another person. They can transfer it to their partner. They have this STI inside of their body, but there is no symptom at all to show that they have it. But when they have sexual intercourse with their partner, it can easily be transferred from them to their partner. You can see this whole thing is tricky. And I also want to let you know that having STI does not mean that particular person is irresponsible or that particular person is dirty. It's just like every other infection out there, like flu. Just that this infection is only transmitted through sexual intercourse. There are a lot of misinformation out there when it comes to STI. People tell you that if you have one sex partner, you are not going to get STI. That is not true. And there are also other misconceptions about condoms being 100% effective when it comes to preventing STI. Good day everyone and welcome back to Nurses Lecture Room. My name is Mercy Mary, popularly known as the Nurse with a Difference. And on this video, I'm going to be sharing with you some signs of some STI. I'm going to be debunking some myths when it comes to STI, and I'm going to be telling you how to prevent STI. But before we go into details into this video, if you are new on our YouTube channel and these are content you're interested in, please click on that subscribe button, turn on that notification bell so you don't miss out. For all my returning subscribers, this is Nurse Mercy Mary saying thank you. Back to the business of the day. Not all STIs have symptoms, but if they do, this is what you should watch out for. In terms of gonorrhea and chlamydia, you should watch out for painful urination and also unusual discharges from the penis or the vagina, and sometimes no symptoms at all. You heard me. But when they are left untreated, can lead to infertility. That is why it is very important for you to watch our video on regular reproductive health checkup, the importance. In terms of syphilis, it starts with a painless sore that disappears. And if syphilis is left untreated, it can damage the brain, it can damage the heart, and it can also damage the nerves. You see, syphilis, these sores, they can be hidden in the mouth, they can be hidden in the anus and in the genital. They can even spread from there. So that is why it is also important for you to go for your regular reproductive health checkup. Because all these STIs that don't surface with signs and symptoms that you expect can be left untreated for a very long period of time. In terms of herpes, we have painful blisters or sores in the mouth or in the genital. The painful thing about herpes is that it cannot be cured, but it can be managed with medications. Now, let's talk about the popular HIV. Yes, it comes with flu-like symptoms, and these flu-like symptoms can be there for years. You heard me right. It can be there for years. And if it is left untreated, it is not managed properly, it's definitely going to graduate into AIDS, which actually weakens your immune system. That is why proper screening, regular screening is important, especially when you are sexually active. HPV is not left out. HPV can cause genital warts, which can lead to cervical cancer in women. The last one I have to share with you before we go into the myths proper is trichomoniasis. Yes, it comes with itching, burning sensation, and foul-smelling discharge. Most people don't have these symptoms and they can spread it to their partner. So now let's talk about the myths. The first myth I would like to debunk when it comes to STI is you can tell if someone have STI by looking at them or by having sex with them. That is totally wrong. Yes, you cannot even tell if someone have STI because some of these STI, they don't have any symptoms for you to predict that someone has STI. The only way to confirm that you have STI is to get tested. Then the second key point I have to share with you, the second myth I have to share with you is when you have just one sex partner, you are not going to get STI. That is a lie. If your partner has undiagnosed STI, they can easily transfer that STI to you, even when you are faithful to that partner, or even during the course of your relationship, that partner is faithful to you, but the partner has untreated STI before they get married to you. So don't feel because you have one sex partner, you are not going to get STI. So the best thing I usually advise is before you start having intercourse with someone, it's very important for both parties to get tested. Yes, don't just trust anybody blindly. Get tested before you go ahead to start having sexual intercourse with someone. The third shocking myth about STI I heard is if I get STI, I am not going to get it again after treating it. My body is going to be immune against it, so I'm not going to get it again. That is a lie. Please and please don't believe that lie. You get, there's some people that treat STI today because their partner is not properly treated. They end up getting reinfected immediately. So please and please don't have that mindset that if you have treated STI this month, you can't get STI next month because you have treated it. As far as you are sexually active, you are having sex, there's an increased chance of you repeating that STI cycle over and over again. Then the fourth myth I would like to debunk is using condom is 100% effective. When I use condom, I am not going to get infected. Though a lot of things can go wrong when using condom, when not used properly and things like that. I also want to let you know that STIs such as herpes, STIs such as HPV can be transferred skin to skin. You heard me. Can be transferred what? Skin to skin. So condom is not going to help you prevent herpes and HPV if it's transferred skin to skin. Then the last myth I have to share with you is if you are a virgin, if it's your first time, you are not going to get STI. STI is meant for those that are promiscuous. That is a lie. If it's your first time, you are a virgin, and you're having sex with someone that has STI, you are going to get STI, even if it's your first time. You get? There's some people that are promiscuous because they are using protection, they are extremely careful. They end up not having any of these STIs. So you might be a virgin, you don't use protection, it's your first time, and your partner is not trusted. Trust me, you're going to get STI from your first encounter. So as far as you are sexually active, STI, you are at risk of it. You're at risk of STI. So being promiscuous or not, what matters is being sexually active. The next question is, how do I protect myself? So the first answer to that question, which is a popular opinion, is the use of condoms and dental dams, because that is going to go a long way to reduce the risk of STI, but it doesn't automatically take away the risk of getting STIs when having sex. It reduces the risk. So use of condoms go a long way. Then the second one I have to share with you is limit your sex partner. The fewer, the better. The fewer, the better. You heard me right. Then the third one I have to share with you is always have an open conversation with your partner. For example, you're having an infection and you just got treated. It's important for you to have an open conversation with your partner so they get treated and avoid reinfecting each other in the long run. The fourth one I have to share with you is get tested regularly. That is why I will always tell you the importance of reproductive health checkup cannot be overemphasized. So if you've not watched our video on why reproductive health checkup is important, I'm going to leave that particular video in the description box below so you have access to that video and know the benefit. Then the last one I have to share with you when it comes to protecting yourself is actually prevention, which is through vaccination. HPV and hepatitis vaccine can be gotten to actually prevent you from getting it. In conclusion, what I have to share with you is sexually transmitted infection is common. It is preventable and it is also treatable. So what is very important for you to do is to get the key facts about your health, be aware about the do's and don'ts when it comes to your sexual health, and also take charge of your sexual health, because your sexual health actually matters when it comes to your overall health and well-being. So thank you very much for staying tuned. Thank you very much for watching this video. Don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got value. For all my returning subscribers, this is Nurse Mercy Mary saying thank you. Bye and see you in our next video.